Biohacking is one of the most trending topics in the recent years.
One word that's taken the wellness industry by storm is biohacking.
Bro, here's a biohacking routine.
What is biohacking exactly?
Biohacking is in the word.
Luckily, a dear friend introduced me to biohacking.
Influencers like Bryan Johnson spending $2 million a year just on biohacking his health.
Let me tell you something. What works for one person may not work for other person, but what worked for one person on a particular day may not work for the same person on the next day. Either to slow down their aging process, either to enhance their performance or their cognitive ability, or they want to do more things in life. We need to always curate health rather than biohacking.
Can we say that biohacking is the reason why celebrities or athletes age differently from the rest of us?
Not just celebrities and athletes, I think a lot of people are biohacking as well.
In simple terms, can you explain what is biohacking?
Lifting weights is a biohack. Doing zone 2 training is a biohack. Cryotherapies or cold plunges are a biohack. How do they know it is working for them? Subjective score is very important. Feeling in terms of energy, mood, cognition, these are very important. But can you just rely on them?
There are some specific supplements that are being marketed as anti-aging supplements, right? Can you throw some light, like which ones are good?
Don't ask me top 3 or top 5, okay? That is a very...
That was my next question. Biohacking is one of the most trending topics in the recent years, and personally I've heard advices starting from taking cold plunges, use CGM hacks, do intermittent fasting, and we've also seen influencers like Bryan Johnson spending $2 million a year just on biohacking his health, right? But I'm confused. Everyone who's listening to these advices are confused because there is too much of information out there. We don't know which of these biohacks are actually science-backed. If I have to choose a particular biohack, how do I know if it suits me or if it is for me? I really don't know. So today I want to discuss which of these biohacks are actually science-backed, and from a longevity medicine point of view, what is your take on most of these popular biohacks?
We are in very interesting times. People are more interested in health now than ever. It is nice to see they're having a lot of focus on preventive health. But all that we are seeing in biohacking world or biohacking industry or people who are biohacking is N:1 experimentation. It's like they don't depend on human trials all the time. If a mouse trial shows that particular gene editing therapy works or a particular therapy works, they go and hack it or they use it. They use the therapy to get the outcome. Okay, but we should note that they're all doing as N:1 experimental trials to change the biology in the body. Either to slow down their aging process, either to enhance their performance or their cognitive ability, or they want to do more things in life. Whatever the reason or outcome is, they focus on human trials or mice trials to choose the therapy that they want to choose and see how that is changing for them. Okay. Now, can we apply it to general population? Can we apply it to anybody? It could be women or men. There lies the question. Not everybody has got same biology. Not everybody's starting point is same. Some could be having disease, some could not be having disease, some have problems in gut health, some have problems in mitochondrial biogenesis, some have problems in repair, regeneration, some are not autophagic. There are multiple things that could be going on. If biohacks are used properly, more studied, if there's a lot of research behind it, and you're tracking it, you're tracking the outcomes, you're testing and not guessing, and you're using the right kind for the right person, it is most likely going to be working.
Okay.
But you should be doing that with a physician most of the times. What I see are people copying a therapy, people copying certain molecule, or people trying to imitate the therapies or processes and trying to see if that is changing for them or not.
Right.
We should be a little cautious about using therapies which are not FDA approved or which are not having a lot of research behind them. There is no meta-analysis. There is no research behind whatever science is there behind using that molecule. So we should be very careful regarding that. So first thing I would say is test, don't guess. We need to always curate health rather than biohacking. I think it's building towards improving the biology so that your functionality improves, your focus improves, your performance improves, right? So you need to curate that. You need to build all those Lego blocks together so that you don't fall off sometime where some therapy didn't work for you just because it is a mice model or a research just done in mice and not approved in humans.
Okay. I mean, keeping the mice models also aside, right? Recently, I've seen a video of, a CGM hack influencer. He was using a CGM and he ate ghee rice with dal and the sugar didn't spike. He has 200K plus followers and he was just advising to eat rice and dal with ghee and the sugar won't spike. But when I wore a CGM with a group of friends, all of us had different results. So, like you said, mice trails are like on one side, but even on like humans, what worked for one person might not work for the other. So, what's your take on the CGM hacks?
Let me tell you something. What works for one person may not work for other person, but what worked for one person on a particular day may not work for the same person on the next day.
Right.
It's because biology should not be looked in silos. Body or health optimization is not just about having a constant low baseline on CGM, right? There could be other things. People always look health in silos. That is a problem. Just because you're having constant baseline CGM values, it doesn't mean your health is optimized, because there are a lot of other parameters, right?
Right.
For you to age well, for you to have less risk of any disease, apart from CGM being on a lower level, there are other things that we need to be doing. Again, CGM it's like a single snapshot from a long timeline. We can't prove something just because you had 100% score on CGM today on metabolically. It doesn't mean your pancreas is very sensitized. It doesn't mean you're insulin sensitive. It may not mean you have good circadian rhythm. It doesn't mean anything at all. So what we need to be looking at, if you look at the complete picture, is how are your fasting insulin levels? How is HOMA-AR? How is your mitochondrial health? We need to be looking at all these things as well,
Right.
apart from looking at CGM values.
Okay.
So it shouldn't be looked at today, last 10 days, my metabolic score is 100%, so I'm very insulin sensitive. It need not happen.
Right.
You're hacking the device, you're hacking the CGM
Right.
there. Because, see, I'll give you my own example, right? If you know how to hack things and if you can prove your metabolic score is higher, you can just do that. But it doesn't always mean that you're insulin sensitive. For example, I could choose a good portion of fat with protein. I can do that. Or I can fast for longer so that my insulin will not spike and I won't see those spikes on CGM. Or I could always do postprandial walks, take postprandial walks, and I walk after every short meal and I can make sure that doesn't spike.
Right. But are these spikes really bad?
But not all spikes are bad. That is also important. Some spikes do happen. For example, you didn't have a good sleep last night and you're just eating fiber and fat, you could still have a spike.
Okay.
Though starting a meal with fiber and a fat composition will reduce your spike. That is true on one side, but it may not happen all the time.
Got
if you
it.
didn't sleep well last night or you're very stressed and you're still eating the same meal, you could still have a spike. So sugars can spike with recent stresses, lack of sleep as well, and you being sedentary as well. There are a lot of reasons. And not every spike is bad.
Yeah.
It is okay to have a good carb meal because you have worked out very intensely in the morning and you need that carbohydrate fueling again so that you can improve the glycogen stores in all your muscles. You need a carb meal.
Yeah.
Just because you want to achieve a 100% score and look at CGM flatline, you avoid eating carbs all the time and not fueling your body enough, then you're not optimizing your body. So that's the reason we shouldn't look at things in silos and we shouldn't look at health as a snapshot, but we should look at the longitudinal timeline.
Got it. In simple terms, can you explain what is biohacking? Because it's all, jargons at this point in time. So,
Biohacking is doing experimentation with one's own body to optimize one's biology.
okay.
As simple as that.
Okay.
It could be changing your lifestyle. It could be changing your nutrition. It could be fasting. It could be adding some supplements. It could be adding some therapies. It could be cryotherapy, sauna, or it could be hyperbaric oxygen therapy. You can choose from any of these, experiment on yourself as an N:1 study, and make sure you're altering your biology.
Okay.
So the end goal could be performance optimization or improving your cognitive health or weight loss or whatever.
Right. So in that case, even smaller things like, even lifting weights, for example, could also be one form of biohacking, right?
Lifting weights is a biohack. Doing zone 2 training is a biohack. Cryotherapies or cold plunges are a biohack. Intermittent fasting in itself is a biohack. But when these biohacks are used during right time of the day, during right cycle for women, they can actually do well.
Okay.
I mean, they can work for you most of the time. But again, you should not guess. You should
Right.
test. How do you know it's working for you? Very important is, what are you feeling after using certain biohack? How is your mood? How is your energy? How are you sleeping? How is your cognition? How is your performance? Did you improve your performance in the gym? So if you're able to change in any of these domains, that is a positive outcome. Or you're testing your inflammatory markers, that has come down, you're testing your home IR, that has come down, your fasting insulin has come down, you've optimized all your minerals and vitamins, that has improved. If these things are happening, that means these biohacks are working for you.
Okay. Can we say that biohacking is the reason why celebrities or athletes age differently from the rest of us?
Not just celebrities and athletes, I think a lot of people are biohacking as well. And a lot of people are aging slower and are much younger than their actual chronological age is.
Right.
Yes, definitely biohacking is one of the reasons, but that wouldn't happen in a single day. That wouldn't just happen like you using blue light blocking glasses for 1 or 2 days and thinking there will be very positive results. So it is a process. It is a habit formation that is important. The circadian rhythm alignment is important. A lot of things go behind the looks, right?
Right.
A lot of investment is needed. A lot of lifestyle changes are needed. A lot of process goes unnoticed. They show only few things and we see that these few things are helping them. See, for example, people do red light therapies. People use blue light blocking glasses. But using just these two would result in the outcomes? No, there are a lot of unseen work that is going behind the scenes that is often not seen. It could be good access to data, doctors, diagnostics, the amount of time that they are investing into this. All these do matter.
Yeah. You keep mentioning evidence-based multiple times, not just today, but then in general as well. So when you say evidence-based, say for example, I'm looking at a research paper and I want to implement something on my own. What is that gold standard evidence?
Gold standard evidence-based studies on the top are meta-analysis. Meta-analysis is basically looking at large number of studies on a accumulation basis and seeing how many studies prove that this point is right. That is meta-analysis. That is a top gold standard research that we need to see. Second is randomized controlled trials.
Yeah.
That is a second gold standard. So I think these two are the top. If we are looking at some research, this is the way we look at the research. We can't look at one single study and say, this study proved that this therapy showed this outcome. We can't pick and choose therapies like that. So there should be RCTs or meta-analysis to prove a point that we are using evidence-based studies to... Let me give you some examples, right? Today we say VO2 max having it at a higher level is going to slow down your aging process.
Right.
But how do you prove it? There are a lot of recent studies which show, for example, there was a study that was shown in 60-year-old adults where they accumulated the VO2 max of at least 55 ml per kg per minute. The VO2 max, that is your ability to draw oxygen or withhold oxygen in the body at your max capacity. If that is on such higher number, it has shown that their biological age is 8 to 10 years younger compared to their sedentary peers.
Okay.
Right?
That's interesting.
This is the research that we're talking about. Also, these studies should be long term. That is the third most important gold standard is longitudinal studies or large cohort studies. We can't just do a study on 10 people and say, oh, I showed result in all these 10 people. Now let's start using this therapy. This showed it result in all the 10 people. No.
Yeah.
We should look at large cohorts and also we should look at long duration of studies. For example, there's another study which is going on, right, called TAME study.
Okay.
TAME trial, where they're testing in elderly people over the age of 60 years who didn't have diabetes, and if they started on metformin in them, did it reduce their age related diseases? So that is the trial still going on. It is going on over 5 to 6,000 people, right? So that is a cohort that we're seeing, and also the trial is still going on. Trial didn't end. So we want long-term studies.
Okay. So why I ask is because for every biohack or for every suggestion which is out there, there are both papers, both researches. I mean, in fact, I was shocked to know that once upon a time in the US there was a study that said that smoking was good for health, right? So how do common people know like where this research is? Or
Also,
like, where
there is
do
a
we
study.
find
Also, there is a study which said intermittent fasting caused
Is bad.
cardiovascular
Yes,
problems.
yes,
See, that
I
is a
read
single
that.
study. Again, their meta-analysis is important. Out of 100 studies, how many studies are proving for it and how many studies are proving against it?
Okay.
So, coming to intermittent fasting, just because we are talking about this, and in the previous videos as well, we were talking why intermittent fasting or time restricted eating is actually beneficial to people. There are a lot of studies like calorie study, time study, which showed eating during early hours of the day and time restricted feeding. So intermittent fasting is basically eating during stipulated number of hours of time, right?
Right.
If you're moving that period to earlier time of the day, which is called early TRF,
Right.
early time restricted feeding. That means if eating with sunrise, stop eating by sunset. It's called early TRF. Early.
Okay.
This study showed their lipid profiles improved, their metabolism improved, their fasting glucose levels improved. So there are a lot of positive benefits. And also it improved cardiovascular. It had cardiovascular benefits. Also there was another trial called calorie trial where people restricted only 12% of the total calorie intake per day. Only 12%. And this study showed there were numerous benefits in cardiovascular parameters,
Okay.
cholesterol parameters, and also other glucose parameters.
Right. So circadian rhythm, eating before sunset, I think to an extent it's like understandable. But Bryan Johnson is finishing his dinner by 11 o'clock in the morning. So
That is his personal experimentation, right?
Okay.
It is working for him, so he's doing it.
okay.
So if other people think it can work for them, they should test and trial for their own.
Okay. Got it. Is sleep like directly, is it like a biohack eating that early is it to optimize sleep?
I can talk about my own data here, right? Everybody's talking their own data because they're biohacking. I have definitely seen whenever I ate 4 to 6 hours before my bedtime, definitely I had very good sleep score. Definitely my resting heart rate dropped very early. And I had good time spent in deep sleep and REM sleep, which are most two important stages of sleep to enhance recovery, mood, cognition, performance, making memories, etc. Right? So I did see the difference. And also it works for most of the people. That's why we say keep your feeding window as away from your sleep time as possible. But again, exactly how many hours away from the sleeping time differs with the individual. It's not same for men and women. Right? Women get hunger pangs towards their follicular phase. When they're in their luteal phase, they feel more they feel more hungry than ever.
Right.
So eating too away from their bedtime is not an ideal deal for them. So they may have to snack a little bit, but not too close to bedtime, at least 2 hours from bedtime.
Right.
So it is very personal, it is very gender specific. In the last video, we were discussing about gender specific medicine.
Right.
That is important. Age specific medicine is important. That is where we say personalized medicine. Personalizing to your own health goals, according to your own diseases, you being a male or a female, or according to your age.
Got it.
So that is
to
where
each of our own.
personalized longevity medicine comes in.
Got it. Since we are talking about popular biohacks, HBOT is something that we've been hearing a lot of benefits, taking continuous HBOT sessions, etc.
Yes.
So what's your take on HBOT sessions? Not just for biohacking, but in general, what are the other benefits that people get if they take HBOT sessions?
Latest interest has been around hyperbaric oxygen therapy. We see celebrities and biohackers going in and out of these chambers, pressurizing at different pressures, right? It definitely has got a lot of benefits. If you look at pathways of aging, there are about now 12 hallmarks of aging, or pathways of aging that we call it. Any research saying that if you do this therapy or if you take this pill, if you follow this lifestyle hack, if you change your sleep pattern like this, you can slow down your aging process. If somebody is saying that, there is some research saying that, then all of those hacks, all of those therapies should affect these 12 hallmarks of aging.
Right.
Hyperbaric oxygen therapy is the only therapy which covers 4 hallmarks of aging.
Okay.
What are they? It improves stem cell production. It improves mitochondrial biogenesis. It increases telomere length.
Okay.
It improves oxygenation and henceforth better cellular communication and better protein synthesis, and it improves improved nutrient sensing.
Got it.
So definitely hyperbaric oxygen therapy allows oxygen to reach the places where it was not reaching before, and improves healing, improves oxygenation, reduces inflammation. The other hallmark it affects is it reduces inflammation, reduces inflammatory cytokines like CRP, IL-6, etc., or TNF alpha.
Right.
And also, if you have known Shai, he's a doctor, very famous person who does a lot of studies around hyperbaric oxygen therapy. He did prove that if people do 60 sessions,
Okay.
60 sessions, and the HBOT chamber is pressurized to 2 to 2.5 times the atmospheric pressure, their telomere length improved by 20%.
Okay.
Their stem cell production also improved by 15 to 20%. That is the effect of hyperbaric oxygen therapy.
Okay. So there's a perception that when people go on walks to parks or like when they are in nature, etc., they think that there is 100% fresh oxygen there, right? So when you suggest someone to take a HBOT, so do they ask this question to you that like why HBOT? There is already a lot of oxygen out there.
There's not a lot of oxygen out there. There's only
Okay.
21% oxygen. 21%. Rest of the 79% is other gases.
Okay.
Right? Nowhere in the world, wherever you go, you'll get more than 21% oxygen in nature.
Okay.
It is only up to your capacity and my capacity, how well I can consume it, depending on my vital capacity, depending on my cardiovascular fitness. If I'm regularly exercising, I'll be able to use that oxygen to my best capacity
Okay.
from within that 21%.
Okay.
And definitely, though in the nature or in the forest, you're not going to get more than 21%.
Okay.
But yes, when compared to living inside the buildings, living in polluted areas, when you come out of those polluted areas, from those restricted areas towards nature, you'll definitely get better oxygen.
Okay.
But not 100%.
Okay. What's the difference between like, if say for example, my vital capacity is very high, right? I'm able to consume better oxygen versus I'm sitting inside a HBOT chamber. Like what exactly happens?
When we are outside in the nature, like in this room or in the forest, if you go on a trek, right? All of us are on the surface of the earth.
Right.
Where the atmospheric pressure is just 1.
Okay.
Okay. If you dive underwater, then the pressures increase. Every 33 feet as you go below the sea level, the pressures increase.
Okay.
When you are under more pressurized environment, your oxygen has a special ability to bypass red blood cells, which usually carry the oxygen to the tissues and cells. It will bypass RBC carrying capacity and flow freely in your blood to reach the areas where it was not reaching before.
Okay.
Generally, in anybody's blood or anybody's plasma, there won't be oxygen more than 3 mil, which is 3 milliliters.
Okay.
Usually it is not. Only when you're in the pressurized environment, that can increase.
Got it.
Right? But all of us do not go diving every day. You must have seen this recent event where a person lived underwater for 100 days and saw that there was improvement in so many biomarkers. His inflammation came down, metabolic panel improved, the lipid panels improved, and he said that I'm biologically more younger after staying underwater, right? So what did this extra oxygen in the pressurized environment do to him?
Right.
What did it do? Same thing the hyperbaric oxygen chamber does.
Okay.
So basically, hyperbaric oxygen chamber is pressurized to 2 or 2.4x times that regular surface level atmospheric pressure. So when you are sleeping or staying inside that chamber for at least 60 to 90 minutes for certain number of sessions, okay, let me take study as an example, right? There is again this study by Shai. where he did 60 sessions for the individuals and proved that the senescent cells, which are this bad
Zombie cells.
zombie cells, these bad zombie cells were reduced by 37% and telomere length increased by 20%.
Okay.
So these are the measurable outcomes. And along with that, what also happened was the inflammatory markers reduced, like HSCRP, and mitochondria was producing better ATP, which is the powerhouse of the cell, produces better energy for the human body, along with improving telomere length and reducing senescent cells.
Okay.
These are the measurable outcomes.
So when you say measurable outcomes, right? Telomere length or, cellular senescence, etc., is too scientific. So how do these measures make me feel?
Okay, not everybody has access to all the tests. Right. Not everybody has access to hyperbaric oxygen chamber.
Right.
But who should choose and why?
Yeah.
Let's start from there, okay?
Yeah.
If a person has traumatic brain injury, HBOT helps. If a person has recently developed a brain stroke, HBOT helps. Patient had diabetic-induced wounds, mostly in the feet, it would help.
Right.
If a person has very high inflammation in the body, HBOT helps heal your body.
Right.
If you have cognitive decline and neuroinflammation, HBOT helps. These are some of the areas or some of the reasons why I would prescribe somebody to get a HBOT therapy.
Got it. Yeah.
If somebody who is biohacking, suppose has HBOT chamber in his or her own residence and is using HBOT for their hacking, how do they know it is working for them?
Right.
Number one, subjective score is very important. How are they feeling in terms of energy, mood, cognition, sleep?
Right.
These are very important. But can you just rely on them and keep taking it for longer? No. There is something called oxygen tolerance units.
Okay.
There are certain number of units that you need to receive before you end the sessions. So for all of us, we have certain oxygen tolerance units. So beyond which time we can't continue the sessions, but we need to give a holiday.
Right.
Right? Otherwise, oxygen can become toxic to us.
Got it.
It is like a very precision-based tool, should be used for right reasons, for right outcomes.
Got it. Moving on to FIR sauna therapy. So what's your take on that, and how is FIR sauna therapy very different from the traditional steam therapies that we've always had?
Any kind of sauna has got wonderful benefits on the human body. It will enhance circulation, it will enhance removing heavy metals from the body, it will allow us to sweat. It is basically very similar to exercise-induced heat stress. It is a stressor. FIR therapy is a stressor, hyperbaric oxygen therapy is a stressor. Whenever you're using stressor to the body, like it is called hormetic stress. It is to be used in right duration and very precisely. Otherwise, it can backfire.
Okay.
For example, as we're talking about FIR therapy, it will improve detoxification, it will improve circulation in the body. Again, let's take studies, right? These are very interesting to remember. There was this Finnish study. Of course, it's on a lot of journals. Men who have taken FIR therapies for at least 4 to 7 times a week had 50% lesser risk of dying from any disease.
Oh,
Yeah.
okay.
And they had 60% lesser risk of any cardiovascular disease. So that is the effect of this FIR therapy, which is very similar to exercise-induced heat stress, where it will keep the body in exercise mode because your core body temperature is rising because of increasing the dry heat around you.
Got it.
But you should be cautious in the sense that the blood pressure and electrolytes should be monitored. And also you can't overuse it. If you're overusing any kind of hormetic stressor in the body, it can alter your autonomic nervous system or your stress resilience as well. You asked me a question, how is it very different from the steam sauna,
Steam
right?
sauna, yeah.
Steam sauna uses water to heat you up.
Correct,
So
yeah.
water heats and then it is a wet heat around you. Your
Right.
skin dries up and you can't tolerate that heat for longer.
Okay.
But when it's a FIR therapy, you're using far infrared radiation as a heat, which is dry heat, and you can tolerate it better. And steam do not always increase your core body temperature above certain point.
Okay.
But FIR therapy does.
Okay.
And you can't sustain in steam sauna for longer time, but in FIR you can.
Okay. Got it. And coming to supplements, right? Many people prescribe to a lot of supplements purely based on research papers, right? What is your take on supplements?
Supplements get a bad rap always. I keep hearing from people, I want to go natural. Don't give any supplement to me.
Yeah.
Can we do it very organic way?
Yeah.
I'm very against supplements. I keep hearing every day, right? They got a bad rap because there's a lot of research on supplements in very recent years. Okay, let me use a better term for this. They're very evidence-based nutraceuticals.
Yeah.
Okay, and they're precision-based tools. If used for a right reason, they bring the right outcome. Like, what are these right reasons? What do we look at when we prescribe a supplement or a nutraceutical for an individual, right? Number one, are they nutrient deficient? Number two, are there any mutations or SNPs, for example, MTHFR mutations, where it can put a person at risk for certain deficiencies for longer in their life, and they succumb to cardiovascular diseases or inflammatory diseases in their future life?
Right.
So, or aging biomarkers. For example, you look at CoQ10 levels at the cellular level, or you look at alpha lipoic acid, or you look at L-carnitine, or even NAD metabolites, right? Any biomarkers that reduce as you age.
Okay.
So supplements are there for a reason. Either we are targeting their SMPs, either we are targeting their nutritional deficiencies, either we are targeting their pathways such as mitochondria or inflammation or methylation, or we are targeting their aging.
Right.
So these are very precision-based tools. I think there's a lot of evidence in recent times around these nutraceuticals.
But I think there are some specific supplements that are being marketed as anti-aging supplements, right? Can you throw some light, like which ones are good, which ones we should not fall for?
Don't ask me top 3 or top 5, okay? That is a very
That
bad
was my
question.
next question.
That is a very bad question to ask. What are your top 5 foods that has gone very bad? Because we can't look at health in silos. What are these top 5 anti-aging foods? No. You should remove certain foods from the body. You should add certain foods to the body.
Right.
If you're deficient in certain things, you need to add certain specific supplements. You should add certain specific functional foods so that you would modulate that biological pathway. You should align with your circadian rhythm. You should follow some lifestyle habits. You should focus on your sleep. When you have to do a lot of things to keep yourself healthy, how can I choose only top 5 things, right?
No, just tell us which ones not to choose, because so many supplements are there which are marketed as anti-aging, aging slow supplements.
Okay, I'll tell you what you can choose, but
Okay.
again with caution, right?
Okay.
There's a lot of evidence now on urolithin, on taurine, on NMN, on all the mitochondrial boosters like ubiquinone, etc. On quercetin, fisetin. Because anything that can reduce the senescent cell does work. Anything that can improve AMPK or inhibit mTOR does work. There are certain pharmaceutical drugs as well which work on these aging pathways. So that way, if you've seen most of the diabetics, though they develop micro and macrovascular complications, they do end up living longer.
Right.
That is also one of the longevity benefit of metformin. That is what the trial I was talking about, the TAME trial, right? What they're trying to analyze is why are these people living longer? What is the effect of metformin on aging pathways?
Okay.
Why is it even helping them to live longer? Is it because it is AMPK booster?
Okay.
So
How about rapamycin?
rapamycin is a senolytic, yes.
Okay.
It has, right now there are not many studies on only aging or reducing your biological age. There are only some studies right now. I think we need a lot of studies, large cohorts, longitudinal studies.
I also get a bunch of gut supplements related ads, right? Like lots of probiotics, lot of good gut supplements, etc. So I always get tempted to almost like order. So, what's your take on these gut supplements that are being over marketed?
If you don't want to change anything in your life, you don't want to change your sleep schedule, you don't want to align with your circadian rhythm, you don't want to remove inflammatory foods, you don't want to eat good whole foods, then nothing will work for you. Let me put it that way. If without working on all these foundational pillars, no supplement can help you, no therapy can help you. I think we should do all these foundational things right, then analyze what is happening, why there is gut dysbiosis, and if you're doing all things right, and then maybe few supplements, few probiotics do work for you. So again, test, don't guess is the strategy.
Let's talk about some extreme biohacks, extreme according to me. So now we'll discuss if they are extreme in general as
Okay.
well. Starting with cryotherapy, right? The thought of 0 degrees itself is like very scary, but I think cryotherapy goes to minus 180, minus 200. So it feels very extreme. So what's your take on cryo?
There is science behind cryotherapies. It will definitely activate brown adipose tissue. The molecule which is the reason is UCP1. It will reduce, it is known to reduce inflammation. It is known to boost mitochondria. It is known to reduce inflammation, all that, right?
Okay.
But it is again a hormetic stress. You have to use it with caution.
Okay.
Not everybody will respond very positively. If you're a person who already has very high inflammation and you have very high cortisol levels and you're a very inflamed person, cryotherapy may not be a right time therapy for you.
Okay.
It may not work. In fact, it can hurt your heart rate variability sometimes.
Okay.
But yes, there is data, there is evidence, there is research, but it has, since it's hormetic stress, it has to be used with caution.
Okay. How about these cold plunges, which do not go to extreme temperatures, but ice baths and cold plunges that are popular right now?
There were a lot of studies that were done, mostly in athletes, that we see that after cold water immersions, their muscle soreness reduces, inflammation comes down, etc., right? But not everything works as is in some studies that were shown in athletes, because today people are using cold plunges or cryotherapies not in athletes. People who are having a disease are doing it, not having a disease are doing it. But what does it actually do? Whenever you are taking a plunge in cold water, we all have this neurotransmitter called norepinephrine, right? It releases by 2 to 5x times. That stays higher in your body for next 4 to 5 hours.
Okay.
That's the reason why you feel more alert, more active, more focused on the days when you take cold showers as well. But when you are doing cold plunges, the norepinephrine levels go higher and stay longer for long.
Okay.
That is one of the most common benefit that we see. And also, cryotherapy, for example, has known to activate UCP1 gene. Basically, it's known to activate your brown adipose tissue. But not everything happens as is in every individual with disease, without disease, in all age groups, because we don't know with what stress resilience they're coming from. Because at the end, it is a stressor to the body.
Right.
And you can't give stressor at a same dose for same duration for all the individuals. So that has to be timed. So these are all precision-based tools. When used for right purposes and right reason for right individuals, they are very, very beneficial.
What's the typical time someone can stay in a cryo chamber?
We all have something called normal body temperature.
Right.
And it is there for a reason. All human beings can function only when our core body temperature is somewhere between 96 degrees Fahrenheit to 98.3 degrees Fahrenheit. Yes.
Right.
Beyond which it's called fever. If it's below that, we call hypothermia.
Okay.
Both are dangerous to the body. If our body should function the way it should function, and keeping all the body systems alive, we should be within this time frame, within this temperature frame. Whenever body is tilted either that way into hypothermia, like in cryotherapy, or this way, for example, when you're exposed to heat, when exposed to heat, we produce something called heat stress protein, HSP.
Right.
That will cause very positive change in the body. That will reduce inflammation, do all the good things to us. Also, when you're exposed yourself to another stressor, which is very, very cold temperatures, like in cold plunges or in cryotherapies, body can tolerate only to a certain extent. During that period, body will develop mechanisms to keep us alive.
Okay.
What are those mechanisms? it's activating something called UCP1G, which can activate brown adipose tissue. If adipose tissue is activated, our ability to tolerate stress will improve.
Right.
And that again has positive benefits in the body. But if you're stressing body too much by taking it for too longer, for too lower temperatures, beyond that, it will give up.
Okay. But
So
why
we
just
can't
3
stay
minutes?
longer.
But why just 3 minutes? Why can't people stay?
That is tentative time, right? Tentative
Okay.
time, and imagining you're with least clothing on the body.
Right.
If you go to colder environments or colder countries, we all wear,
Cover up.
we all do cover up, right? That is to protect our body mechanisms. And if imagine you're in minimal clothing, you can't stay longer. That is because our body adaptive mechanisms will fall apart.
Okay. So does that mean that the more like I biohack or the more
It doesn't
peak,
mean the longer you stay in cryotherapy, that means the better person
it's
you
not,
are.
okay.
No. These these hormetic stresses should be used very precisely for precise amount of time. I said FIR therapy is good for you. It doesn't mean you do FIR therapy 3 times in a day for 7 days in a week. You'll have all the electrolyte imbalances. You'll be deficient in electrolytes. You'll be dehydrated. Your blood pressure comes down. So what was supposed to actually help you will harm you.
Okay.
So there is a very thin line between help and harm. If you're using that therapy for precise time, it will help you. Otherwise, it's going to harm you.
how many times a person can take a cryo therapy in a month?
A person can take cryotherapy for up to 2 to 3 times in a week. But if you are a person who has never taken it in your life, you shouldn't push so hard. You can start off with once a week, and you can't go up to minus 160 degrees as well. You can start off with minus 110 and slowly reduce your temperatures as you get used to, as you get tolerate. So basically, I mean to say, human body is not a polar bear. If we are a polar bear, we tolerate very low temperatures.
Right.
We are human beings. We all have thermostatic mechanisms. All the body systems will keep us only in certain temperatures. So when you're taking your body to extreme temperatures, right, either it's too low or too high for too longer, your enzyme systems will fall off. Your body mechanisms will shut down. Your digestion slows down. Your blood flow to the brain will reduce. So all these harmful changes happen when you cross that time limit beyond 3 minutes.
Got it. So, circling back to extreme biohacks or biohacks to step up the longevity game, one interesting therapy is stem cell therapy, right? So, explain us how stem cell therapy works, and at this point in time, is it reachable to everyone?
We all have some stem cells when we are born, but that is a very small storage. Okay. Stem cell is a cell which can generate into any type of organ system in the body. That cell can become a nerve, it can become a liver cell, it can become a blood cell, it can become a bone cell or a muscle.
Okay.
That is called stem cell. Its ability to generate into any organ system in the body. But we all have limited stem cells when we are born. Okay. Now, in the recent years, there's a lot of study going on stem cell, on how to use it for regenerative medicine.
Right.
Can we regenerate the lost nerves? Can we regenerate the lost cells in the eyes? Can we regenerate the ovaries where people have infertility? Can we regenerate bones when there are issues? So there are a lot of regenerative therapies already started in gynecology, orthopedics, in neurology. So things are already happened. People already have started using stem cells to regenerate, either during surgeries or to improve ovarian preserve. I think it's already on the way, on the go. It's already happening.
Okay. Where do they take these stem cells from if we did not save it during the birth?
We all have something called allogenic stem cells, where it can be taken from our own body parts, either the hip crest, from the hip bone, That's the
Okay.
most common region where they're taken. Stem cells are preserved. You have heard about umbilical cord stem
Right.
cells
They
or
save
dental
it
stem
these
cells?
days.
These are preserved, right? These are preserved over a course of time, either to use it within your family members or for yourself. But most of the time, they are not suitable for other individuals.
Okay. How about hormonal boosters used as biohacking tools?
I think it's not like a band-aid where something is low, you patch it up. Estrogen is low, you patch it up. Progesterone is low, you take a pellet. Testosterone is low, you take a cream. It doesn't work like that, right?
Okay.
Hormones are very intricate packages. They all work together. They all metabolize in certain way. If you are putting somebody on some kind of hormone therapy, then there are certain things that need to be monitored. For example, if you're starting a testosterone on in men, then you have to monitor their prostate levels, their prostate glands, etc. Similarly, in women as well, you have to monitor their breast, etc. So I think it's again a very precise tool when used for right purposes. Monitoring closely, monitoring their labs very closely, it can bring benefits.
Right.
Like for any pharmaceutical drug, or for that matter, for any drug, everything has got some kind of a side effect.
Right.
And we need to mitigate those effects. All these hacks as well should be used precisely in precise doses, precise timings, and the effects always should be monitored.
So I think at this point in time, it feels scary to take in charge of my own health because of all these things that we just discussed, right? So for someone who's curious but very overwhelmed, what do you advise them to get started? Like, should they follow like a specific protocol? What can they do on their own? For what, like they need to reach out to a physician? How do you want to guide them?
All of us have access to getting all the blood biomarkers today. What are the most common ones that we should be getting it done even before we can reach out to a doctor, right? We should look into inflammatory markers, metabolism markers, all the, that means including fasting insulin, C-peptide, HbA1c, HOMA-IR, etc. All the nutrient panels to look into magnesium, zinc, B12, folate, etc. All the electrolytes, organ systems. I think these are not to miss blood tests, because let me give you one example. There was a 55-year-old woman who walked into the clinic other day. It was surprising for me to see. A year ago, she got her panels done, and her HbA1c was more than 8, and that was missed, and she never got the treatment. And when she was in my clinic, the HbA1c that was repeated before she reached out to me was 9.5.
Okay.
So over one year
aggravated.
time, things got aggravated or worsened, and the report went unnoticed. So I think it's also some people are getting the test done. It's also important you reach out to the doctors to show and to find out if there is any actionable that this action that you have to take. Simply getting test doesn't do anything for them.
Right.
They should act upon it after getting the test done. What should be done is very important.
Right.
So I see that these mistakes often. Either people underdiagnose, do not do their diagnostics, or some people self-diagnose or do not reach out to doctors or miss out on some crucial diagnosis. So both can happen.
Got it. Also, I feel we discuss so much about biohacking, we discuss so much about testing, etc. So it feels like to achieve optimal health, one needs to spend like a lot, right? So with research on longevity and more adoption, do you see that it becomes more accessible in the future?
Who is not spending on a healthcare? All of us will eventually end up spending on healthcare. It's either we spend later when we fall sick and we are crippled, or we choose now, spend on ourselves, invest and become a better person. You can choose what time you want to invest. It's either later, only to extend your whatever life is left crippling, or now where you invest on yourself, where it becomes very productive and it's like savings.